Dr. Andrea Shanowski from Freedom Chiropractic and Holistic Health and our YouTube channel, Health and Horsepower. This week, I'm going to talk to you a little bit more about how heart health is linked with magnesium. A lot of you don't realize that magnesium is an essential nutrient that's used in 300 different enzyme reactions in your body. Magnesium is also acting like a natural muscle relaxant. So that means it not only can help to relax your heart muscle to ensure that we have good contraction and relaxation to help be more efficient with pumping blood around your body and also helping with lower body swelling. But magnesium also helps to keep the blood vessels open and patent so that you have lower blood pressure. Another thing that magnesium is helpful for is muscle cramps. So if you are experiencing issues with fatigue, stress, muscle cramps on a regular basis, you should be making sure that you have magnesium in your everyday nutrition. I typically recommend most people take a good quality multivitamin with a B complex that ideally is methylated, so it's less hard on your liver. I also recommend taking a magnesium along with that and an omega-3 if you're not getting enough healthy fats in your diet. So very important to realize that magnesium is so critical to your heart's function because, again, we need calcium to contract our muscles, magnesium to relax it. We also need magnesium to relax our blood vessels so that that blood flow can go all around your body, helping with heart health. Another thing that they found in some of the research is that if your magnesium level is on the low end, or if it's out of normal range, that can also lead to heart arrhythmias and irregular heartbeats. So if you have heart palpitations, if you have an irregular heartbeat, if you have an arrhythmia and you're not taking a magnesium, you may need to add one in. Now, a couple things to think about it when it comes to magnesium. Magnesium is water soluble, so that means you need to make sure you're getting plenty of water in your diet to help it absorb, and also take water with that magnesium to make sure you're getting enough. A couple other things you can do is look at food sources of magnesium. Things like spinach, pumpkin seeds, as well as mangoes are high and rich in magnesium. You can also do Epsom salt soaks as well and absorb them through your skin. Now, the form of magnesium does matter. So if you have a magnesium at home or if you're looking in your multivitamin and it says magnesium oxide, that is a clue that that company is using the cheapest, least absorbable form possible to cut corners and save them money while not actually helping you. So if you have a magnesium oxide at home, I would recommend throwing it away. Your best bet to get a highly absorbable form is looking at a magnesium citrate, which is a fast absorbing form. If you tend to have some tummy issues or a sensitive stomach, or things tend to go right through you, I would probably recommend to go with a magnesium glycinate or a malate. Those are slower absorbing forms that tend to be less irritating to the digestive tract. So couple forms, magnesium citrate, probably one of the fastest absorbing, but again, it can cause some tummy troubles. I personally like to recommend magnesium glycinate or a malate. We carry a product called Magnesium Plus here in our office that is a blend of the glycinate and the malate. So you get the slow absorbing forms that are gentle on your tummy, but also making sure you're getting high quality absorption so you get what your body needs. At a bare minimum, I do recommend taking at least 400 milligrams a day. But because magnesium is water soluble, we can also do what's called a magnesium calibration. That means we're going to take magnesium a little bit at a time until we have enough. When your body has enough and can't absorb anymore, that magnesium is going to come out through the stool like a looser texture, more of a, I'm sorry, apologize for this visual here, more of a soft serve texture, like a soft serve ice cream. So if you're getting a softer stool, that means you've had too much in a single day or too much in a single dose. I usually recommend doing 2 in the morning, 2 at night to start, so that's about 400 milligrams. If we're still getting muscle cramps, if we're not getting that loose stool, I would recommend going up to 2, 3 times a day, so you're doing 6 in a day. And if 6 is too much, then you're going to go down to 5. If 6 isn't enough, you're going to keep going up. I have some patients that have taken about 200 milligrams in addition to food sources. I have some that take 1,000 a day. So it depends on what your body needs for magnesium. Also keep in mind, magnesium is also great for bone health. It actually helps to solidify the inner portion of your bone and make it a little bit more structured and a little bit more stable, so we're less likely to have compression fractures. So very important to make sure you're getting magnesium, not just for heart health, but for a lot of other things. So like I recommend, I would start with about 400 milligrams a day with plenty of water, and then you're going to do that calibration. I usually recommend keeping that calibrated higher dose for about 6 weeks to make sure you're actually rebuilding your storage of magnesium, because magnesium is stored inside your red blood cells as well as inside your muscles and your bones. A lot of times when we're looking at lab testing, typically magnesium red blood cell source, not serum magnesium, is what we want to look for when we're looking at magnesium levels and making sure they're in range. So if you have any other questions, feel free to post some comments below, or you can call our office 309-689-6200 and schedule an appointment virtually or in the office.